Hello and welcome to Dr. Joy's Mammographia. I am Dr. Ajith Joy, and today, on the eve of World International Women's Day, I would like to wish all the women a very happy Women's Day. How is it important and what is it important today to our company connected with Women's Day? This year, 2023, is a landmark year for the Doctors Diagnostic Center group of laboratories. It completes 40 years since its beginning in 1983. And also, the DDNMRC group, that is Doctors Diagnostic Nuclear Medicine Centers, completes 20 years, and this is the 20th anniversary year of DDNMRC. As part of our anniversary celebrations, this year we are launching our next flagship company and brand, Dr.JOY'S Mamografia. The sole purpose of this company is to offer a breast cancer screening program which will last for 10 years. Why screen for breast cancer? This is a question that many ask. Or sometimes they ask, is mammography the best method? And is 2D mammography any better than 3D mammography? What is the difference between 3D mammography and 2D mammography? There are too many questions here. Before we go into the specifics of that, let us just take a look at some statistics that is present in India. Did you know that when 6 women get diagnosed of breast cancer in the USA, only 1 woman dies of breast cancer? Whereas in our country, when 2 women get diagnosed of breast cancer, 1 dies. That's 50% mortality rate. Means there is a 50% death rate. People ask why. See, 30 to 40 years back, probably mammograms are there since 50 years, and there's a lot of experience, and the West has adopted it. They've learned through it. It's covered by insurance over there, and they've been regularly doing it. This is one of those reasons where early diagnosis has become a possibility. And in early diagnosis, 95% of women, if diagnosed early, could be in a curative therapeutic approach, meaning they could live for 20 years, 15 years on an average without the disease having to affect them or succumbing to the disease. Whereas in India, if you look at it, 67% of women land up in late stages. That means they do not have these options of early stage treatment options like breast conservative therapies, or they directly go into the chemotherapy, they go into the radiotherapy or combination therapies or secondary line therapies. There are many things that happen with this. Cost increases. The results are very less. Results are not as good as what it would be if you get diagnosed at the early stage. So there's one single thing that can change the whole approach to breast cancer treatment, that is early diagnosis. And of course, there are tools for that. You have the 2D non-digital mammography rampantly across places in India and Kerala, but women are either not willing or have a fear of radiation or are not willing to, or they think it's a painful procedure. They do not compare the value against benefits from this reality of screening breast cancer with mammograms. On the 20th anniversary of DDNMRC, which is directly into imaging breast cancer patients when they come in for post-therapy imaging or pre-therapy imaging, we see among our studies, our stats are like out of 10 to 12 cases in a day that one of our centers does, 5 to 6 of them are breast cancer patients who have had a repeat disease. That means their disease is progressing. That means it was never controlled on the first line of therapy. That means the disease has mutated again and it has progressed again. So this is another reality which I would like to bring, and this actually gave us the thought to bring in a comprehensive breast cancer screening program, which is just not like one-time screening once and then the lady discontinues it. So something that is comprehensive, something that is continuous, something that can deliver a substantial benefit to whoever enters into this program. That is how we have decided to bring out this Dr. Joy's Mamografia based 10-year breast cancer screening program at a one-time cost of rupees 8,500. For knowing how to join, please follow the links after this video. There we've given the website, the phone numbers to call, join our Instagram page and Facebook pages, and talk to your friends and family, whoever would like to and want to know more about it. Please give us a call. We believe this is the best gift that you can give your loved ones. So on the World International Women's Day, once again, wishing you a happy Women's Day.